having challenges, finishing school, and but he thought because he was doing all these things that he could be an adult. And so he decided to move out from his parents at age 18 and live in his own apartment and get his own job. He was working for a veterinarian, and he found that he couldn't show up to work on time. You know, he thought he could be an adult, but he couldn't be an adult. And he loved his job. He loved working with animals. He loved working with the vet. It wasn't because he didn't like it, but he just didn't have what we talked about earlier. He didn't have self-control. He wasn't able to manage his emotions. And he went into things like alcohol and vaping nicotine and marijuana and all of these things, which made it even worse. And so finally, he couldn't even, now that he lost his job, he couldn't pay his apartment bill. And he felt defeated because he had to move back with mom and dad at 19 and hadn't really been able to complete anything and was getting very discouraged about life. So somehow his grandmother heard about our program at Weimar. And and he looked at it. He's a smart kid. He looked at the data ahead of time and the research on it. And he told us at the time he thought that it was probably incorrect, or somehow the numbers were fudged. We hear that a lot in regards to the research because it was well in the high 90% success rate. And he said, you know, with all of the mental health problems, how can it be that good? But we have a part of the program, and of course we did find some things biochemically. We'll get into some of that. Oh, I see it up here. I don't see it back there. I don't know if we can have it back there so I can see what's going to be on the screen. If we can turn on that screen back there. Okay, he's going to do that. About halfway through the program, we have morning and evening sessions that center in on some science along with the Bible stories that bring out ways of distorted thinking, a little bit like we did earlier today. And he began to really resonate with the Bible. We also have a study on Daniel. Every chapter in Daniel starts out with a disappointment and ends with an appointment. And he was pretty excited about the stories in Daniel. And his father, he's such an unresponsible kid before he came. His father actually flew him all the way out from the East Coast and stayed in a Airbnb, still working for the military on his computer every day, but just being there so he would be outside in case his young man decided to leave or whatever, because he couldn't really trust him to be able to manage himself. And so he just wanted to be close by. But he calls up his father. And about halfway through the program, everything started clicking, and he says, "Dad, I feel better than I have felt my entire life." And he says, "You know, I think I know why they have success here." He says they're dealing with the spiritual part. None of the other psych places ever dealt with the spiritual part. They never went into the Bible stories. They never went into all of that. And he said, "I'm really liking the Bible. In fact," he says, "I think I want to become a Christian." And he says, "I think I want to attend church." Well, an hour before that discussion, we have some master's students. As I mentioned, we have master's students going through our university. And there's 4 master's students at a time that will shadow a program. So they get to see it from the inside, from the spiritual counselor, and see all that. So these master's students at least one of them had been there with him and things like that. And the master's student is meeting this young man in the hallway as he's through with one of the lectures, and he says, "You know, I'm really worried about my dad." He said, I'm really wanting to be a Christian. I don't think my dad's ever going to become a Christian. And what's going to happen to him if he's not a Christian? And what happens to people when they die? So this is the young man's question, 19 years old. And the master's student, right there on the spot, the chaplain, of course, was busy with other things, but the master's student said, well, do you want to know what the Bible says on that subject? So went through what the Bible says on the subject. And so an hour later now, he's talking to his dad on the phone, telling him how good he feels and how this spiritual part is there. And he said, son, there's a reason why that I never brought you to church. He says, you know that they believe that if you don't accept Christ, you're going to burn in hell forever and ever. He says, I can't accept that, and that's why I never brought you to any church. And his son says, Dad, that's not true. That's not what the Bible teaches. I just learned about that. And so he goes into what the Bible teaches, how death is asleep, and how you're waiting a resurrection, and there's no ever-burning hell, and all of those things. And his dad is listening to this Bible study now given by his 19-year-old. And the dad says, well, son, if you're going to become a Christian and go to church, I'll go to church with you. And that was on a Thursday, so Sabbath comes about, and we actually do model church attendance one time in the program, their last time, and we give them the science behind it. Studies shows, for instance, that if you attend church on a regular basis, your chance of ending your own life is less than 50% of those who do not attend church. By the way, there's no medication on the planet that has that success rate or anything like that. And so we go through the studies on church attendance, and then we say, if we're going to model everything that's going to help your mental health, we need to model church attendance. And so tomorrow we'll attend the only church in Weimar, California, and it's the community church. And so we invite them to church. So he invited his dad. He said, Dad, you said you'd go to church. We're going to church tomorrow. I'm excited about it. And he said, well, you come with me. And so this young man was so excited. The master's students, along with the chaplain, had gone through with him all of the major beliefs of the Bible, and he was eating it up during the program. And he got baptized that afternoon into the Weimar church. And his depression scores went from severe depression to no depression. And he is set up for future success. Off his nicotine, off his marijuana, off his alcohol, all of those things. I talked to him last week as well, and he was a little discouraged because he thought for sure, now that he had cleaned up his act, that the veterinarian would hire him back. And he says, I'll be able to go back, and now I'll be able to show up on time and do all of those things. And he went back, and the vet said, you messed up so many times. We can't take you, even though you say you've cleaned up your life. You need to prove yourself first beforehand. And so he is getting another job, but he thought everyone would just open the door for him, but he didn't realize that, there's a history there, and people doubt that the brain can change that quickly. So he's having to go through that, but his real desire is actually to come to Weimar and go to college there. He made some friends during the time there, and one life in 10 days completely changed. But part of it also had to do with nutrition, and so let's go into this aspect, which is one of the most overlooked aspects of mental health today. And I'm trying and it may not work from this far back. Let me try pointing it at the clock. No, it's not advancing. Try it again. It works up there. Maybe it's too far away. Oh, here we go. I'm getting it. Hey, look at that. Okay. It's now working. I might have needed to set up the antenna differently. This is the synapse. This is the connections in the human brain. And there's over 100 trillion connections in your little 2.5-pound brain. that you have in your skull. It is one of the most amazing, it really is the most amazing design that you can imagine. And over 100 billion of these neurons and over 100 trillion connections. There's some big cells in the brain, Purkinje cell, that one cell firing can influence 20,000 other neurons. And so there's different types of neurons and cells. And how communication occurs is there's an electrical signal that is sent that releases this chemical called serotonin. And this is just a micro hair of a length between, and it picks up actually serotonin can be picked up by this serotonin receptor, and then another electrical signal occurs. Now, a lot of times people get confused. Serotonin is the one that's most likely going to have your doctor try to boost your serotonin levels, because serotonin does lift mood. It also helps with irritability and agitation. It's the most commonly prescribed drug for panic disorder and anxiety disorders. And the doctor will prescribe this medicine and say, this will help you with your serotonin levels. Does that medicine actually help you make more serotonin? It does not. Does it help your neuron pick up more receptors? It doesn't do that either. So how is it helping? What it does is, by the way, if serotonin, let me just back up a little bit. Some of you are nurses and have worked in an ICU unit. Another neurochemical that's used a lot in depression is boosting your dopamine levels. We'll talk about the difference in what these different chemicals do. But if dopamine could cross the blood-brain barrier, or serotonin could cross the blood-brain barrier, we would just take depressed people and give them IV serotonin or IV dopamine. The problem is your arteries, when they get into your brain, are like steel pipes. They won't let serotonin across. They won't let dopamine across, for good reason. Our blood-brain barrier is there to protect the oldest cells in your body from being destroyed prematurely. The most important organ in your body is the brain. It's why it's enclosed in this big skull. And the oldest cells in your body are in the human brain. So the cells that were being formed even in the first trimester and being pushed up into your brain are actually still alive. And those cells can be prematurely destroyed by toxins. Toxins are normally big molecules. And so to protect the brain from all of these toxins, we have this blood-brain barrier. What does that mean? That means that the brain has to make its own serotonin. It can't get it from the outside. It has to actually make it from the raw materials. And the brain is designed to do that. First, we have to get tryptophan into the brain, and then that tryptophan has to turn into 5-hydroxytryptophan, which then can turn into 5-hydroxytryptamine, which then makes serotonin. And so we can actually train the brain and help the brain make more serotonin, but those are natural things that are going to do that. So how do the drugs work? The first SSRI that was released was called Prozac, and now there's many others. There's Zoloft, sertraline, fluoxetine, there's escitalopram, there's citalopram, there's paroxetine, Paxil. I'm sure a lot of you have heard of these drugs, and then there's some that do more than one thing, SSRI, Cymbalta, duloxetine, Effexor, Pristiq. And so these are all molecules that actually are able to get into the brain. They can cross the blood-brain barrier, but what they do is they get sucked up by this vacuum cleaner here. This vacuum cleaner, once serotonin attaches here and electrical transmission occurs, that serotonin is released. And because it takes so much energy to make serotonin, it actually is vacuumed back up so that it can be used again. So these medicines, we call them SSRIs because they stand for selective serotonin reuptake inhibitors. What they really should be called is serotonin vacuum cleaner pluggers. They're plugging the vacuum cleaner of serotonin, and that actually does help short term to have more serotonin in this synapse. If we're blocking the vacuuming it up, you get more serotonin around here, and it can bind onto the receptor if we have a shortage in it. And so these medicines, it takes them about a week to be able to plug up those receptors well. That's why they don't start working right away. And then they can start plugging up those receptors, and you can start to actually have some improvement in your mood, in your social aspect of things, if indeed you have a serotonin shortage, which may not even be your problem for depression. This is why everyone coming into our program, we're actually looking at the synaptic activity to see what the precise issues are so we know exactly how it will be helped. But if you are blocking the vacuum cleaner in that releasing neuron, what is going to be the ultimate effect? Anyone? You're going to have even a greater shortage of the very substance you're trying to treat, because now you're depleting the neuron of serotonin being reuptaked. And if you already had a problem manufacturing it because you were short in it, you're going to have more problems. And this is how we produce what's called psychiatric cripples. In other words, the medicine worked for a while, but now after 9 months or a year, there's relapse. And the person's taking the medicine. So where do they go? They go back to the doctor, and now the dose is increased. And then another medicine is given. And by the time a person ends up in our program, often they're on 4 or 5 different medicines, very severe depression, and no one has told them that you can actually do something to help your brain make more serotonin without having to plug vacuum cleaners and run into all of the side effects. By the way, Dr. Whitaker at Temple University, you can look up that name if some of you doubt this, because we have doubters in every group that we speak to, and they're saying, I've never heard that antidepressants can have long-term problems. Well, look up Dr. Whitaker at Temple, and he clearly demonstrates through a lot of different studies and analysis that when we release antidepressants in a community, the rates of depression start to go up in that community significantly within a year. And the reason being is we're just doing a patch job. This is why medicines are not the answer to the mental illness problem we have. We have more medicines available than ever before. We have more medicines prescribed than ever before, but yet we have more depression and anxiety than ever before. And unless we get to the root issues behind it, we are going to see continued acceleration and continued lack of being able to have emotional control. So let's get into some areas that can be problem areas. One of them can be not enough tryptophan. You may not have enough tryptophan in your diet. Tryptophan is that amino acid building block to make serotonin in the brain, or you might have it in your diet, but it's not getting into your brain. It turns out tryptophan doesn't go across either. It's too large. You have to have a carrier to bring it across. And that carrier has to have to do with carbs and insulin. If you're having carbs with tryptophan and you have insulin receptors that are working, you'll get tryptophan to cross the blood-brain barrier so you can make more serotonin. And so serotonin is converted, or I should say tryptophan is converted to serotonin. And then serotonin at night is converted to what in the brain? Melatonin. What does melatonin help us with? It helps us with sleep and to have rejuvenating rest. It's also a very potent antioxidant, 30 times more potent than vitamin E. And so it actually can help us even against COVID. Some of the studies on COVID have demonstrated that melatonin is one of the key ingredients if you get COVID to protect yourself from going into the cytokine storm and having a severe case of it because of its antioxidant effect up front. It's also converted to niacin. The problem with it is it's the least abundant amino acid in the diet, and the conversion of tryptophan to 5-HTP is inhibited by stress. So this is one of the interesting things. If we're not coping with the stresses around us, we might have tryptophan into the brain, but it's not being turned into serotonin so readily. This is what we call a vicious positive feedback cycle. And this is why it's not just a biochemical fix. We've had a lot of people come to our program saying, I only want my biochemistry fixed. I don't want the cognitive behavioral therapy. I don't want to have to deal with my thoughts. You just need to fix the chemistry in my brain. Well, here's the thing. We're not going to be able to, even if we do fix the chemistry in their brain, to have all the nutrition there, unless they're able to manage their thoughts, they're actually going to have less serotonin being made. So studies have actually shown cognitive behavioral therapy changes brain chemistry for the better. It's not just a workaround in trying to trick the system in some way, shape, or form. It actually is helping us biochemically. And so this is why we, of course, use the combined approach. It's not just CBT. In fact, some people say, well, CBT only works about half of the time in people. Well, the reason why it only works about half of the time when that's the only therapy being utilized is that therapist is trying to get you to analyze your thoughts and correct your thoughts when you don't even have the biochemical ability to do that. You have these negative automatic thoughts that just come, and you don't really have that ability to analyze and change it because that therapist is only working on the CBT, not on the biochemical part. And so when we do the combined approach, that's when we start seeing the rapid improvement, such as what we notice in our program at every program. So the conversion of tryptophan to 5-HTP is inhibited by stress. It's also inhibited by insulin resistance. What's another name for insulin resistance? Diabetes. And the new name for diabetes is called diapression. Because if you have diabetes, you're going to have more problems making serotonin because you don't have insulin sensitivity to get enough tryptophan into the brain to make the serotonin. So this is why in diabetes you have these people on this whole list of medicines, to try to help their diabetes, and then they're also on SSRIs and all of these other things because of the things that come with diabetes, plus cholesterol-lowering medicines, plus blood pressure medicines, and so you'll see this whole laundry list of medicines to try to control it, when in reality, all we need to do is change the diet and change the exercise. By the way, improving insulin resistance, you can improve it by lowering your sugar intake, but in addition to that, you improve it by regular aerobic exercise. And that's why in our program, we get people fit. Most people are not fit when they come to our program, but in 10 days, they're going to be fit. We have good exercise people working with them, and this will actually improve their insulin sensitivity and will actually improve the biochemistry of their brain. In addition, it's inhibited if we're short in magnesium. This is why we measure everyone's magnesium level in B6. Lack of light. We talked about it earlier today, but we need tryptophan in the brain with light through the eyes to be able to make serotonin. And the light has to be bright enough to actually produce this. This is why we recommend people get outdoors to get bright enough light. Or if not, that they get a medical grade light box. Everyone in our program in the wintertime, we actually give them a medical grade light box. It actually simulates its exact wavelength of the blue sky, and they'll actually wear this light. It'll be like glasses on them. We wake them up at 5:30 every morning, and they get their light. And that light of 30 minutes will reset their body clock, and it will also start this manufacturing of serotonin in their brain. And it will actually help them make more melatonin at night. So it ends up being a win-win. Within 7 days, they're sleeping better, they're more energetic in the morning, and they have better control of their emotions, and their mood is definitely better. So tryptophan has been shown in controlled trials to improve premenstrual dysphoria from ovulation to the 3rd day of menstruation, depression and seasonal affective disorder. It's also been shown to improve insomnia and obstructive sleep apnea. Now, what's the most common treatment for sleep apnea? Anyone know? It's a CPAP mask, yeah. What's one of the most effective treatments for sleep apnea, however? It's weight loss, yeah. 80% of people won't even need a CPAP mask or have sleep apnea if they get down to their ideal lean body weight. But a lot of people are unaware that if we are making enough serotonin, we won't have this stoppage of breathing in the middle of the night. And so there's brain biochemistry involved in it as well, and tryptophan has actually been shown to improve sleep apnea. And it also improves nicotine withdrawal. In every one of our programs, we're seeing it more commonly. We have nicotine addicts, and they're pretty potent nicotine addicts. They're even worse than cigarette smoking, which was tough, but now with all this vaping, they're getting more concentrated nicotine, and it is a really tough habit to withdraw from. And, as I mentioned, the story that I started out with, this guy was on nicotine big time, vaping. In fact, he had his last vape in the airport, brought it with him, thinking, this is my last time at the Sacramento airport. And then, on marijuana, on a number of these other drugs, he was even taking some opioids, those sorts of things, in order to have short-term fixes to alter the way he's feeling. But he was amazed that he didn't really miss the nicotine after 2 or 3 days. We're doing hydrotherapy. We're doing things, front-loading their brain with good tryptophan, and this really helps them significantly. This is why we have to tell people when they're in our program, this is the rainy season to make new ruts in your road, the roads in your brain, which are your thought patterns. And you want to be able to start that process well, because once you leave there, it's very tough again. And so it's far easier to get over things like benzo addictions and those sorts of things in our program, which we deal with all the time. So let's take a look at the foods that are high in tryptophan. When I was in medical school, I was told that whole milk was a great source of tryptophan. And you can see it's not bad, 46 milligrams per 100 grams. But there are higher sources: black-eyed peas, black walnuts, almonds, sesame seeds, gluten. If you are not sensitive to gluten, gluten is actually healthy for you. A lot of people think all gluten is bad for everybody. Not true. Gluten is called wheat meat. It's actually quite high in tryptophan, and a number of studies show the advantages of whole wheat as far as brain chemistry is concerned. But if you are allergic to gluten, fortunately, you can get even higher sources. Pumpkin seeds are an excellent source, and tofu, I'm sorry you can't see, it's cut off there, 747 milligrams, you can barely see it there, per 100 grams. And so that's a more concentrated source of tryptophan. But it's not just the tryptophan content, it's also the ratio of the competing amino acids. A lot of people make this mistake. They think tryptophan is a building block of protein, so in order for me to make more serotonin, I need to get lots of protein. Big mistake. Studies show that if you get lots of protein, you're going to have more competitors blocking the tryptophan uptake. Those are other large neutral amino acids, and you'll get less serotonin produced in your brain. You want to have adequate tryptophan, but you don't want to have too much of other protein molecules, other amino acids, to cause this issue. So if we take a look at the top of the screen, and I know it's small writing there, but those are 40%. In other words, whole milk has 40% tryptophan in 60% of the competitors. Salmon has the same, 40 and 60. Which one of those two, I know I haven't said this plainly yet, but I'm asking you so that we can make it plain. Based on what I've told you already, which one of those two would get more tryptophan into the brain? Salmon or milk? Anyone want to guess? Some are saying maybe salmon. I heard milk over there. Milk is true. You will make more serotonin from the tryptophan in milk. Why is that the case? because milk has carbs. Salmon, high in protein, high in fat, virtually no carbs. It's a carbohydrate deficient food. In general, meat is going to be a carbohydrate deficient food. And so it's hard for you can get tryptophan in your muscles from eating meat, but you're not going to be able to get it into the brain. So let's take a look at the next three. Beef, chicken, and brown rice. Both of those, all of those have a little higher percentage of tryptophan. Out of those three, which one would you get more tryptophan into the brain? Brown rice. All right, you're getting it now. And then black-eyed peas are higher yet. Soybeans are higher yet. Black walnuts are near the top of the list. Pumpkin seeds near the top. Tofu is actually not at the top, but it's near the top. Almonds, you'll actually get more tryptophan into your brain from almonds. And I'm sorry it doesn't show the very bottom of the screen. Yeah, it didn't even show it here. We were translating it. I think it's another display program up there. But the bottom, which is the very top in tryptophan, is actually sesame seeds. Sesame seeds have 81% of tryptophan, only 19% of the competitors, and this is why hummus can be very good in managing your emotions, or tahini, or sesame seed butter. So studies have shown in stress-prone subjects, which are those that are going to have a challenge as far as serotonin, carbohydrate, high carbohydrate, low protein. Now, when it says low protein, it doesn't mean it's deficient. It's just lower in protein. Food prevents a deterioration of mood and performance under uncontrollable laboratory stress conditions. Stress-prone subjects have a higher risk of brain serotonin deficiency. In such subjects, higher natural carbs increase personal control. Carbohydrates prevent a functional shortage of central serotonin during acute stress due to their potentiating effect on brain tryptophan. And this is a key aspect. This is why a lot of people who are just into the ketosis diet, they don't realize that that's not manageable long term, because the carbohydrate deficiency is going to end up with serotonin shortages in the brain, and also even dopamine and norepinephrine shortages. So ketosis can be good short term. We actually recommend, we'll talk about ketosis coming up. Ketosis can actually be very positive for the nerves. It turns on brain-derived neurotrophic factor, a fertilizer in the brain. But you want to be able to have carbohydrates along with the ketosis, which we'll explain here in a bit. Tyrosine. Tyrosine is another amino acid, and it's incorporated into proteins of all life forms and is a precursor for the synthesis of thyroxine. What is thyroxine? That's thyroid hormone. Does that have to do with your mental health? It does. It also has to do with your energy and your metabolism. It also turns into melanin and kephalins and 2 neurotransmitters. What are the neurotransmitters? Dopamine and norepinephrine. So we talked about serotonin helping you to be calm and mood elevation, but norepinephrine is a cousin of adrenaline, so this is what's going to give you energy. A lot of people with depression and anxiety have all this fatigue. Norepinephrine is going to be a secret to have more energy in the daytime. And dopamine is your motivator. If you're having problems with motivation, it's probably a dopamine problem. And I would assume if we were to do a controlled study versus those that were here earlier this morning, and taking a look at the group that actually came at 4:30 and the group that didn't come at 4:30, that the group that didn't come in 4:30 have significantly lower dopamine activity in their brain than those of you who had enough interest and motivation to actually come tonight to do this. And of course, this is why for some people it actually does require them a program. Some people are not motivated enough to go through any even outpatient program, so they need our residential program where we're going to be feeding them and we're going to be exercising them and all of that for their dopamine levels to pick up. And then once it does, then they're able to be motivated, like this young kid. He wasn't motivated to be able to show up for a job that would help him. But now it's all changed as a result of what has taken place. So tyrosine is a potent antioxidant. It also stimulates growth hormone production, and it's of therapeutic benefit in improving depression. It also improves high blood pressure. Interestingly, one of the ways in which the drugs try to increase your brain norepinephrine level is by plugging the norepinephrine receptor reuptake channels. And when it does that, those are drugs like Effexor and Pristique. When it does that, it'll actually raise your blood pressure. And that's one of the risk factors of taking these SNRIs, we call them, selective norepinephrine reuptake inhibitors, is high blood pressure. But when we get to the source of the issue, which is not enough tyrosine in the brain, not only will your energy pick up, but your blood pressure will go down if it's elevated. So we get a win-win. When we start treating the underlying issue, we get a win-win. We don't get any bad effects from that. It also helps out with stress, cognitive function, memory, even Parkinson's disease, PKU, and narcolepsy. I notice a few of you might have some issues with narcolepsy here. I won't point you out, but what is narcolepsy? Narcolepsy is when you want to stay awake, but you can't. You're falling asleep. And actually, adequate tyrosine can help that considerably. Now, speaking of Parkinson's, Parkinson's is a disease where you're not able to make dopamine in an area of the brain called the brainstem, or the substantia nigra. And just a little story about one of our patients. We have a selection process. In other words, not everyone who wants to come to our program is allowed in our program, because we only have so many seats, and we have to actually choose those that are most likely to be able to respond to all the measures. And this lady had advanced Parkinson's disease, and she was denied access to the program. Her husband called when she was denied access and asked our nurse case manager to go over her case with me. Says, I think Dr. Nedley's going to have more compassion than you, and we want her in the program. And so I reminded the nurse when he called me, I agree, that's a selection criteria where we rule them out, because we also don't have 24/7 nursing care. We can't feed her, we can't dress her, those type of things. And her Parkinson's was advanced, she was in a wheelchair, 24/7 essentially nursing care. So the nurse told him that as well on the next call, and he says, I will take care of that. I'm going to come with her. I'll be her companion. I will feed her. I will dress her. I will do all the things for her. You won't have to do any of that. Please let her in the program. Well, our program was getting ready to start on Thursday, and on Monday morning, I get a call from her neurologist at Johns Hopkins in Baltimore, Maryland. He's the Parkinson's expert at Johns Hopkins, and he says, Dr. Nedley, I know she has advanced Parkinson's. I know you're not going to be able to cure that, and I'm treating that. I'm not asking you to do anything about that. But a lot of her issues are depression. Will you please let her in the program? And after getting that call, I told Sarah, our nurse case manager, I said, if anyone cancels, by this time the program was filled, but if anyone cancels, why don't you move her to the top? Sure enough, Thursday morning, somebody canceled, and they were called, and they were on the next flight out of Baltimore to Sacramento. And the rest of our staff hadn't been told this. I knew about it, but I hadn't told the rest of the staff, and they know the exclusion criteria. So when this lady in a wheelchair is there at the airport to be picked up, and our program director heard about it, she comes to my door and says, how in the world did we let this lady in? She can't feed herself, she can't dress herself. I said, well, her husband said he's going to do all that. Well, how do we know the husband's going to do that? I said, well, before she's admitted, I will see her and make sure that this is all still going to be the way he said it would. You know how it is when people think they're in the program, sometimes things change. And so I had an interview with her, and she said, and he said, I'm going to feed her, I'm going to dress her, I'm going to do all of these things. Please let her stay. So we allowed her to stay. We put her on the bottom floor where they didn't have to go through stairs to go up to the cafeteria. But that visit, it was Thursday evening, I said, you're not able to make dopamine in this part of your brain. And so we want you to have the substrate for the few cells that are making it. We want it to be able to make as much dopamine as possible. So I'm going to put you on L-tyrosine supplements. So I put her on a nice dose of L-tyrosine that evening, another nice dose in the morning, and I was not there, but our staff was there when he wheeled her out of the inn on the bottom floor, and she tells him, stop the wheelchair. He stops the wheelchair. She says, put the brakes on. He puts the brakes on. And then she gets up out of the wheelchair and starts walking uphill to the cafeteria. And he's saying, honey, don't. You're going to fall. Don't do that. Let me help you. And she says, get out of my way, as she's marching uphill to the cafeteria. So if it can do that for someone with significant challenges of Parkinson's, what do you think it can do with someone that doesn't have challenges with Parkinson's? It can make a big difference by changing the diet to get more tyrosine into the brain. So tyrosine, those given tyrosine have significantly reduced headaches, stress, fatigue, muscle aches, and sleepiness compared to controls. Improvements are noted in mood, mental states, happiness, mental clarity, hostility, and tension, and cognitive tests also improving. Math skills, coding map compass, pattern recognition in the tyrosine group. And feelings of vigor and improvements in blood pressure also improved. But it's a different set of foods that are higher in tyrosine. You can see the greens have a fair amount. Lamb's quarters also do as well. By the way, lamb's quarters are not the hind leg of a small sheep. What are lamb's quarters? You should know in Texas. It actually is a weed. It's a green that grows. I know we grew it in Oklahoma. I would imagine it grows here in Texas. Erica always recognized when lamb's quarters was coming up as a weed, and she allowed it to grow until it was nice and tender. High in tyrosine, high in calcium, by the way, too. Tomatoes, also. Tofu, even higher than tofu, however, for tyrosine is edamame, or green soybeans. Almonds, oats, sunflower seeds, peanuts, and at the top of the list are pumpkin seeds and squash seeds. But tyrosine also is a large molecule and has competitors. Not as many as tryptophan, but there are 3 competitors, and this is the top of the list as far as the competition is concerned for getting tyrosine into the brain. Sweet potato, flax seeds, chia seeds. We probably shouldn't have beef on there, even though its ratio is accurate here. But beef, again, being a carbohydrate-deficient food, we need the carbs to get tyrosine across into the brain. Tofu is better. Pumpkin seeds are actually number 5 in getting tofu into the brain. Soybeans, spirulina, and at the very top are watermelon and mustard greens. Now, how can this play a role? I'll give you another story of an individual who came to our program with high anxiety. He was having panic episodes, and he also was from Texas. He actually was a trucker that worked for a company that made parts for oil drilling. And he would have to sometimes, it'd be 4 o'clock in the afternoon, and his boss would call him and say, they're drilling over there in Albuquerque, New Mexico, and they don't have this part, it just broke. And they've got 100 men over there waiting to work in the morning, and they can't work without this part, and so you need to deliver it to them. So he would have to drive all night long to deliver this part to the place where they were drilling the oil. And of course, they'd pay a lot of high dollars for that, but it was cheaper than paying 100 guys that aren't working, when you add it all up. So this is how business works. And so he said, I understand why we're being caffeine-free here, because it is helping with my anxiety. But he said, I'm going to have to go back to caffeine as soon as I go back to work, because I don't know when I'm going to get that call at 4 o'clock. I said, once you're caffeine-free for 2 weeks, and he was already caffeine-free for 10 days at our program, so just 4 more days, caffeine-free, I said, tyrosine will actually keep you awake if you eat it in the evening. He says, so tell me how to get that again. I said, well, the highest source are mustard greens and watermelon. Which one would you like to choose? Which one do you think he chose? Watermelon. And he noticed that right off. Watermelon in his truck, and he would have this watermelon juice, and he says, I like it far better than caffeine because caffeine wired me. I didn't like it. It did make me anxious. It caused problems. But with watermelon, I have no anxiety with it, and I stay awake, and I'm able to do well. But that's a warning for you all. Once you're caffeine-free, don't have watermelon late at night because you'll want to stay up, and you'll have lots of energy because of that increase in tyrosine. So don't chow down on high-protein sources to boost either tyrosine or tryptophan. Emphasize carbohydrate-rich plant sources of nutrition. A third aspect that has to do with brain health is folate. Folate is one of the B vitamins. Sometimes it's called vitamin B9. And studies have shown if you're deficient in folate, no medicine on the planet will help you as far as SSRIs and all of these other things. By the way, there is a medicine now that has been approved, I'll tell you a little bit about it, that actually can help for this condition. But what those medicine manufacturers don't tell people is, if you would just eat enough folate, you wouldn't have to take our drug that costs $225 a month per se. So let's take a look. The U.S. government has targeted folate as being undersupplied in the typical American diet, which is true. They recommend we get 400 micrograms a day, which is what you need to prevent neural tube defects if you're pregnant, or prevent anemia, macrocytic anemia, and those sorts of things. But they don't necessarily look at the mental health things. And studies shown to make enough of all the neurotransmitters, folate needs to be at about 1,000 micrograms a day, which is quite a bit of folate. And you can see the folate you would get from a double serving of steak, 5.5 ounces of double serving of steak. If you're going to try to get 1,000 micrograms out of steak, you probably have to eat so much steak you might die that day trying to get your 1,000 micrograms. So there are better sources: parsnips, pineapple juice, orange juice, peanuts, mustard greens are very high in it. Spinach is even higher yet. Navy beans, higher yet. Okra, higher yet. And the two highest sources, lentils. Yes, we had lentils today. They were very good lentils for lunch. 1 cup, 831 micrograms of folate. You almost get your 1,000 micrograms right there. In one food, you can get your 1,000 micrograms from just one serving of it, and that is black-eyed peas. And so over 1,000 micrograms. And folate, we'll talk about its involvement here in a little bit, but folate's going to help you make 3 different neurotransmitters in the brain that are crucially important. By the way, how did the drug manufacturer be able to patent this drug that helps with this condition? You know, the drug manufacturers are interested in nutrition because of how it might be able to help them. In fact, I think I met someone in your church today. I don't see the individual here that actually has a PhD in nutritionist, but works for a pharmaceutical group, and this is why they're interested in this, because if you actually try to patent folate, you know, because what they could do is just provide you with folate or folic acid. You can buy that, it's really cheap, it's a supplement, or you can get it in the food. But if they try to patent that, the US government will send them back a nice letter saying, prior art, it's been in nature, you're not allowed to patent this at all. And of course, once they patent it, they would restrict anyone else from producing it as well. And so they're not allowed to do that. So what they did is they actually took folic acid, natural folate, and they added a methyl group to it. Methyl is just carbon and 3 hydrogens, so they altered it a little bit. And then they had to have a controlled trial to see if it would work for depression. And they found out it actually worked pretty well. It worked very similar to folate. And so now that it's a foreign molecule and it's not in nature, they can patent it. And that's what they did. They sell it for about $250 a month. It's called Deplin, and it's now manufactured as another name as well. But in reality, in most cases, all you would need to do is get on a diet that's conducive of getting 1,000 micrograms of folate a day, and you could save all of those issues. And by the way, Deplin, because it is altered from nature, does have a side effect profile that folate does not have as well, that you have to worry about. And so another issue that is very important as far as brain health is atherosclerosis. Atherosclerosis is caused by cholesterol hardening the arteries. It can cause mini strokes and decrease in circulation, but it also has an issue even before it does that. Studies show that patients with major depression tend to have significantly higher cholesterol levels than healthy adults. Depression patients with elevated cholesterol have a poorer prognosis for treatment response, meaning that they tend not to respond to medicines very well unless their cholesterol goes down. Lowering cholesterol levels improves depression and mood and improves impulsivity. This is why we're measuring all these things when people come to our program. We're measuring their folate levels. We're measuring their cholesterol. We're measuring their bad cholesterol. We're measuring their good cholesterol and all of those sorts of things. By the way, one drug company, a statin manufacturer, actually treated depression in those that had high cholesterol with just a statin. And they found out the depression improved significantly when the cholesterol went down, even with a statin. But there was a group that actually got worse, and that is their fatigue gets worse on a statin. And so it has benefits and risks. You don't have benefits and risks when you're lowering it through diet and lifestyle. And so you don't have to worry about that fatigue aspect. In fact, the energy level will improve. By the way, lowering cholesterol levels improves depression and mood. And notice this win-win. It also improves what? Impulsivity. Let me talk a little bit about impulsivity. The drugs that I've just been telling you, the ones that plug the vacuum cleaners, they all have black box warnings on their package insert. What do those black box warnings say? They actually state that it can increase the risk of suicide. So you're giving a drug to help depression that increases the risk of suicide. Why does it increase the risk of suicide? Because it worsens impulsivity. Those drugs worsen impulsivity before they improve the depression. And this is why it's actually dangerous to actually administer these drugs for someone who's thinking about ending their life, because now you've made them more impulsive. And suicide is often an impulsive act. And so this is, once again, why we need to get to root causes instead of just trying to medicate it, which has tipped a lot of people, unfortunately, over the edge. Normally, it's when the first month that they start taking these drugs that they'll actually end their life as a result of an impulsive act. But if we lower the cholesterol through diet and lifestyle, I actually improve their impulsivity and improve depression. That's a win-win. You know, I'll just tell you, in our last program, we had 25 people in the program. 14 of them were at least occasionally suicidal out of that group. Some were only thinking of ending their life less than a quarter of the time, some half the time, some every day thinking of ending their life. Now, when you get admitted to a psych ward, you get put on a safety plan, meaning that you're being counseled on what you can do instead of ending your life to alter the way you feel that's healthier, which is a good thing. But it's far better to get rid of the actual thoughts and the impulsivity behind it. And in 10 days, 13 out of those 14, we measured again at the end of the program, 13 out of those 14 within the last 5 days of the program had never once even considered ending their life. In other words, the thoughts were gone. They were gone. Now, 1 out of 14, we recommended they stay a little longer. Their thoughts had went from every day down to less than a quarter of the time, but it was still there, and we knew that it would be better for them to spend a little more time until that improved. But in a typical psych ward, they don't think those thoughts can improve. That's why they just do a safety plan. And because they think those thoughts are just going to be there, and so they have to work on the safety plan aspect of things. I'm not against safety plans, but why not deal with the underlying issues that are causing it? And then those thoughts actually do go away. And so, cholesterol, where is it found? It's not in fruits, grains, nuts, or vegetables. Zero cholesterol. This is one of the advantages of a plant-based diet. Even skim milk has 4 to 5 milligrams of cholesterol, 2%, 18 milligrams. Whole milk, 33 milligrams. Egg whites are the only animal exception rule. No cholesterol in egg whites. Mayonnaise, 8. Ice cream, 29 milligrams. Butter, 31 milligrams. But notice the egg yolk, loaded with cholesterol, 213 milligrams. If you're going to eat eggs, throw away the yolk. Just eat the whites. A lot of people are confused about this. They think tuna is part of the plant kingdom and has no cholesterol. But tuna does have a liver, as does every fish. That liver produces cholesterol. And you put a plant-based vegetarian on tuna and their cholesterol levels invariably go up. Clams and crab even more. A lot of people are confused about this. They think if they scrape the fat and the skin off their chicken, they have cholesterol-free chicken. But notice, you scrape the fat and the skin off, still 73 milligrams per 3-ounce serving. Pork, 76 milligrams. Beef, 80 milligrams. And if you don't scrape the fat and the skin off your chicken, which most don't, 82 milligrams. People don't realize white meat actually has more cholesterol than red meat when we're not scraping the fat and the skin off. And it does have consequences. A lot of people think, well, seafood is the way to go. I know when I was in Oklahoma, I had a lot of people who told me they were on a seafood diet. And I had to ask them what that meant in Oklahoma. And most of the time it meant I see food and I eat it. And when they would tell me that, I would think, you know, you didn't really need to tell me that. I could tell just by looking. But, nonetheless, a lot of people think seafood is healthy, but it's laden with cholesterol. Oyster, 84 milligrams. Sardines, 120. Shrimp, 165 milligrams, loaded with cholesterol. And then when we get to the organ meats, very loaded. Kidney, 329. Liver, 410. Caviar, 500 milligrams. And if you see anyone feasting on beef brains, you have to wonder about their intentions. 1 3-ounce serving, 1,697 milligrams of cholesterol. Now, the more cholesterol in your diet, the higher your cholesterol goes. But we've learned that not all cholesterol is the same. This was a result of a study that was actually initiated by medical students in New York. And it's kind of interesting somehow to see how we decide to study certain things. But in this particular medical school, the students all had to do a study before they could be graduates. It helps doctors to know what's actually involved in studies and all of that sort of thing. And it didn't have to be important enough to publish it, but they just had to do a study that had not been done. They're not duplicating what others are doing to make it easy on them. It's just something that hadn't been done before. And so these students were looking through what had never been done that they could do, and they realized nobody had ever fed pure cholesterol to rabbits and monkeys before. And so they said, we'd like to feed pure cholesterol to rabbits and monkeys and see what happens to them. And their study got approved, and then they had to go to Dr. Taylor in the medical school because he was the cholesterol researcher, and he says, why are you coming to me? You've already gotten approval. And they said, well, we need cholesterol to feed to these rabbits and monkeys. And we thought you might have some since you're the cholesterol researcher. He says, yeah, I've got pure cholesterol. It's been in that bucket a long time, but it's nothing but cholesterol. You can go ahead and feed that to them. And so these rabbits and monkeys got fed that cholesterol in that bucket every day. And within a matter of a few weeks, they started to develop heart attacks and strokes. And they started to have closed blood vessels. And the students knew that they had They had accumulated their data, they wrote it up, they were able to graduate, and they left. But Dr. Taylor is thinking, cholesterol is bad, but that bad? Just a few weeks? And then he started to think, you know, that bucket I had given them had been exposed to the air. I'd had the lid off for a while. It had become discolored. I wonder what would happen if we fed pure cholesterol that's never been exposed to the air to rabbits and monkeys. So he's now taking over the study because the students are gone, and he's feeding pure cholesterol to rabbits and monkeys that's never been exposed to the air. It's a clear, waxy substance. And those arteries were clean. Weeks later, no damage to the arteries. And then he realized, okay, people aren't just eating cholesterol, they're eating food that has cholesterol in it. And it's obvious that the oxidized cholesterol is the damaging cholesterol. And so he would feed monkeys this food for just one day, and then he would count the dead cells in their aorta. It doesn't take long for the damage to be done, less than 24 hours, and you're doing damage to your arteries with oxidized cholesterol. What do you think was the most toxic food as far as cholesterol is concerned for damaging arteries? Number one was actually custards. Now, what are custards? Eggs, milk, sugar. When you mix up sugar in a cholesterol environment, you will heavily oxidize it. What's the most commonly consumed custard in America? Good old-fashioned ice cream. That is the number one custard, and that is what will produce the most damage. By the way, one of our board members at Weimar, he actually read the book Proof Positive. It was given to him by one of his employees. We have this study documented in Proof Positive. And he actually read the back part of the book, the appendix. It talks about Ellen White and how it lines up with science. And so he actually became a Seventh-day Adventist after reading that book. And then he started to, even before that, he had changed his diet into plant-based, but he loved ice cream. So he was disappointed about this study, and he actually is a very good cook. And so he came up with 32 flavors of ice cream, one more than Baskin-Robbins. And this ice cream gets rated higher on street testing than regular ice cream. What do you think the base was that he made it out of? Well, it wasn't a milk base because it couldn't have cholesterol in it. I heard something over here. Cashews. It wasn't cashew-based. Not fruit-based. Not soybean, but oat. That's right. If you mash up oats, it'll actually become very creamy. Don't need much sweetener in it at all, far less than what ice cream has. And you don't have to worry about any oxidized cholesterol. If there's no cholesterol in it, you don't have to worry about oxidized cholesterol. But he had problems naming it because you can't call it ice cream unless it comes from cow's milk. Even if it's goat's milk, you can't call it ice cream. And so he finally woke up in the middle of the night and he said, I got the name. And it's called We Can't Say It's Ice Cream. And they did allow him to have that. And you can actually get that in Whole Foods if you look for it. And it's going to go other places as well. Number two, most damaging, pancake mix. It was actually Aunt Jemima's pancake mix. Why was that so damaging? What is pancake mix? There's sugar in it. There's eggs. That's right. You're powdering up sugar, eggs, and flour, and when you powder it up, what are you doing to it? You're oxidizing it. And that was the second most damaging. Third most damaging, someone said pork earlier, which is actually true. Lard is actually tied for the third most damaging, but tied with lard is Parmesan cheese. Once again, you're powdering up cheese into these little pieces to put on, and as you powder it up, you're oxidizing the cholesterol that's in cheese. And so this study also helped to explain some earlier studies that we couldn't figure out before. The big study in Western Electric in Chicago showed that dietary cholesterol is an independent risk factor for coronary disease, no matter what your blood cholesterol is. Some people pride themselves, hey, I can eat cholesterol because my cholesterol in my blood is low. No, if you eat it and it's oxidized, it'll still do damage to you. But it also explained another study done in a state nearby Texas that is known as the most unhealthy diet of all 50 states. Anyone want to guess who has the unhealthiest diet? Louisiana. Yeah, the Cajun food there. And the way some mothers eat in Louisiana, the cholesterol in their breast milk is higher than what it is in cow's milk. They're eating fast food, their cholesterols are really high, and their cholesterol in their breast milk is very high. And there's also a problem in Louisiana, and that is you'll have 18-year-olds and 20-year-olds dying of heart attacks. They'll start to get atherosclerosis in infancy often, fatty streaks in infancy. And so in Bogalusa, Louisiana, they did a study on infants, taking a look at the infants that have clean vessels versus the ones that begin to have the fatty streaks. Which one do you think had the fatty streaks? Those consuming human breast milk or those consuming cow's milk? You would think those consuming human breast milk because of those unhealthy mothers in Louisiana. It actually wasn't true. Those consuming cow's milk had the atherosclerosis, not those consuming human breast milk. So what was the difference? Anyone want to guess? Why were they protected? Because the way infants consume human breast milk is directly from the nipple. It's not exposed to the air, and it's not oxidized. So the best way for you to drink your cow's milk? Go down to the barn and get it straight from the cow, and don't allow it to be oxidized. Actually, that may end up with a head concussion, and that can be a problem as well, so you may want to be cautionary on that. Interestingly, years ago, the term especially harmful was used in that classic book, Ministry of Healing. Especially harmful are the custards and puddings in which milk, eggs, and sugar are the chief ingredients. The free use of milk and sugar together should be what? Avoided. Once again, way ahead of her time, and of course, she didn't sure know about that study that would come out later. By the way, antioxidants help us in a number of ways in regards to our brain health. It helps both anxiety and depression. And it was observed that patients with generalized anxiety disorder and depression had significantly lower blood levels of antioxidants in comparison to healthy controls. After dietary supplementation of these vitamins for a period of 6 weeks, a significant reduction in anxiety and depression scores of patients was observed. By the way, what are the antioxidant vitamins? Vitamin C, vitamin A, and vitamin E. A, C, and E. So that's what they were supplementing with. But it turns out there's something that's more potent than taking these vitamins. And that is the power of whole plant foods. It actually exceeds that of their component parts. 1 cup of cooked kale, for instance, which is a very great antioxidant vegetable, has 50 milligrams of vitamin C and 13 units of vitamin E. That's a very healthy food to have that much of it. But the antioxidant potential of that 1 cup of kale has been shown to be equivalent to 800 milligrams of vitamin C and 1,100 units of vitamin E. So what's better, taking the vitamins from the kale in a bottle or just eating the kale? Eating the kale is far better. And that's why whole plant foods eaten whole are a great way to go. And so someone was asking me earlier today, what are the very best foods? Well, of course, it depends on what we're trying to achieve and maybe the genetics of the patient to some degree. But in general, the very healthy foods for everybody are going to be the high antioxidant foods. In the Human Nutrition Laboratory in Baltimore, Maryland, recently did a study on the top 10 antioxidant fruits and vegetables. First, we'll take a look at the vegetables. Number 10 on the list, eggplant. Very great antioxidant vegetable. Number 9, corn. Number 8, onion. Number 7, red bell pepper. Number 6, beets. Beets are a humble vegetable, but they're loaded with antioxidants. Even beet powder has been shown to lower your blood pressure, kind of equivalent to a medicine. Number 5, broccoli. Number 4, Brussels sprouts. By the way, we were in Taylor, Texas yesterday, and for lunch we actually looked on at the ratings of this site for plant-based food, and they told us the best plant-based food was in a restaurant that's actually in the old Taylor High School, or right next to it where the band room is. I'm trying to think of the name of it. Erica just walked out, but it's, is it Pullman, something like that. And they had Brussels sprouts there. It was one of their main menu dishes with mixed vegetables, excellently cooked. Most of our people, when they hear about Brussels sprouts, they don't want to eat them. But at Weimar, they also cook them very well. In fact, we tell them, make sure you eat the Brussels sprouts, and they love the Brussels sprouts at Weimar. So a lot of it has to do with the cook. Number 3 is spinach. Number 2, kale. What's the number 1 antioxidant vegetable? You think, yeah, mustard greens might be up there? The number 1 antioxidant vegetable, you heard about it earlier today, garlic. And this is one of the advantages of being married to a Romanian like I am, because every entree starts out with 4 cloves of garlic. The top antioxidant fruits, number 10, grapefruit. Number 9, kiwi. By the way, some people are worried about grapefruit when it comes to medication. What's the issue with grapefruit in medicine? Does anyone know what it is? Grapefruit greatly increases the absorption of your medicines. They know that a lot of your medicines don't get absorbed and they don't get into the bloodstream, but when you take them with grapefruit, that whole pill is going to get absorbed. And so it'll be higher doses, and so that's the issue. If you're eating grapefruit with medicines, you'll want to decrease your dose substantially to get the same dose that you would have otherwise. Kiwi is number 9. Number 8, cherries. Number 7, red grapes. Number 6, oranges. And number 5, a very humble fruit, but loaded with antioxidants, plums. And then the top 4 are all in the berry group. Raspberries, number 4. Strawberries, number 3. Blackberries, number 2. And number 1, blueberries. And of course, those have anthocyanins that make them particularly potent. By the way, blueberries have been shown to help preserve your memory when you get older. In fact, studies show those anthocyanins from the blueberries actually produce a blue hue in the memory portion of your brain after you're eating them. They actually are taken up by that portion of the brain and help protect the brain from age-related cognitive decline. And then there are things that can have a specific effect. This is something, as I mentioned earlier today, we'll measure everyone's genetics and epigenetics. A lot of times people do genetic studies, but that only tells you part of the story. The real part of the story is, are those genetics actually producing a problem? Some of our mutations actually are never expressed because of the diet and lifestyle that we're on. and some of them are expressed. Are they being expressed or not? So we do epigenetic studies, and we can actually find out, is there a problem with methylation? Are they having problems making enough of these certain neurotransmitters? Or maybe they're making too much of other neurotransmitters, and so we're looking at all of that activity. And this particular plant tends to help out with those who are under-methylators. Under-methylators tend to have a personality that goes with them. They have a calm exterior and a tense interior. They tend to be competitive, meaning that if they play sports, they're going to win. Often it's your baseball pitcher staring down that batter and doing whatever they can to strike them out. Baseball pitchers are known to be under-methylators, and they also have high rates of depression and anxiety and things like that. They also tend to have more of an addictive personality, and they also tend to not be as naturally empathetic. They might be that way for those that they love and they're related to, but as far as the average person is concerned, when they come across them, they're not all that empathetic. By the way, there's also over-methylators. We'll measure this. Over-methylators have plenty of serotonin, and they will be naturally empathetic individuals. In fact, if you have a chance to move in next in a neighborhood, you would want to move into an over-methylator, because when they're cutting their lawn, they'll call you up to see whether you want your lawn cut. and they will be more caring individuals. But a lot of that has to do with brain chemistry. A lot of times people are amazed when they come to our program, because we'll do the blood and then we'll tell them about their personality. And they'll say, I can't believe that you know all this about me. How do you know this? You didn't even ask any of these questions. Well, we don't have to ask. We can see it right there in the blood. But the good news is we can actually deactivate some of these mutations. And saffron, which is what those red stems are, can do that. Saffron, 30 milligrams daily, equivalent to Prozac, in 6 weeks in improving depression scores, but no sexual side effects with the saffron, unlike there is with the Prozac, and it also improves premenstrual syndrome and hormonal depression. Even smelling it helps. And it also worked as well as the leading drug in treating Alzheimer's without the side effects. It actually seems to inhibit the amyloid beta protein, so we also utilize it for memory. And then for generalized anxiety disorder, or panic, or irritability, there are specific things that we might use for individuals who are having challenges like this. One of them is called Selexon. And this study was done with this molecule, 80 milligrams a day. Relief of generalized anxiety disorder in 76%, with over double improvement compared with placebo. And it also improves sleep quality, even though it's not sedating, because it's getting rid of anxiety. And as mentioned, there's no sedation there. Then they actually tried it against Lorazepam. Big caution on Lorazepam or Ativan. Lorazepam is short-term gain, long-term problem. And that's because it shuts down your ability to make GABA-aminobutyric acid, because it's binding onto those receptors. So the brain says, I've got these receptors all being bound, I don't need to make it anymore. And so it shuts down the manufacturing plant of a neurotransmitter that'll help you to stay calm under stress. And so that's why you have this dependency. And so without it, your anxiety is tenfold worse than what it was before. Doctors know how to put people on these drugs. They don't know how to take people off them, particularly if they've been on for more than 30 days. These drugs were never really designed for long-term usage. They might be helpful in certain situations for short-term usage, but long-term usage, it's going to be a long-term problem. So they actually looked at this simple Selexon and as an anxiolytic, getting rid of anxiety and also helping sleep. And they found out that it actually had almost identical anxiety-relieving properties to Lorazepam, but without any of those side effects. In fact, they even used it in test anxiety. There are some people, will even have them at Weimar, where they're actually learning the material, but they get so anxious before a test that they bomb the test due to their anxiety. And so the studies show if you give someone Lorazepam, if they have test anxiety, do you think they're going to do better or worse with Lorazepam? Their anxiety will get better, but their test scores actually do worse. Why is that? Because it's a frontal lobe suppressant. It's suppressing your ability to think during the exam. Where if you give Selexon, it actually significantly improved their test scores. And it didn't produce any frontal lobe suppression. So this is what I was actually telling one of the store owners who was wanting to make millions off of marijuana. I said, why don't you get Selexon 80? This is very simple, and it doesn't have any bad effects. And it actually, it has no habituation, no sedation, no frontal lobe suppression, but he didn't seem to be too interested in selling things that only had benefits. And it's kind of sad where our society is at. Notice the study says, since lavender oil, that's where it comes from, lavender, showed no sedative effects in our study and has no potential for drug abuse, Selexon appears to be an effective and well-tolerated alternative to benzodiazepines for amelioration of generalized anxiety. And of course, this is what we used in Christy that I told you about today. She had this high anxiety on benzos and things like that. She was on a better diet, getting the exercise, of course, coming off these drugs, and we gave her Selexon 80. She doesn't need it anymore, but she needed it as a bridge in order to be able to help her to get to the place where she could be anxiety-free and depression-free without it. Then B12 is also important. This is a pathway that is important for making 3 different neurotransmitters. We need folate for this. We need 5-MTHF, which has to do with genetics. We need B12, particularly methylcobalamin, to make enough SAMe, that's S-adenosylmethionine. And once we get enough SAMe, we can produce the final step in the brain of dopamine, serotonin, and norepinephrine. This is why some people are short in B12. They'll feel better within 3 days of a B12 shot because they actually aren't able to make those brain neurotransmitters without it. So we measure everyone's B12 in the group as well. And depending if they're an undermethylator, we're going to put them on methylcobalamin. If they're an overmethylator, on hydroxycobalamin, which is actually a detoxifying form of B12. We stay away from cyanocobalamin that has the cyanide molecule in it, but that's what most of the B12 supplements are. It'll help you with B12 deficiency, but you don't want to introduce cyanide if you don't have to, and that's the cheap form of B12. Then if you fast for over 12 hours, metabolism of fat stores release fatty acids called ketones to be produced, which improve memory, learning, and reduce neurodegeneration. Resting our guts periodically through daily fasting triggers a cascade of hormonal events in our bodies which boost our body's repair mechanisms. And one of those things that are boosted is BDNF, which is brain-derived neurotrophic factor. It's a brain fertilizer. It goes up with as little as a 12-hour fast and can go up even more in a 17-hour daily fast. So again, we're going to look at the metabolism of our patients, but for many, they will actually do better on a good breakfast and a moderate lunch and then not eating supper. Amazingly, they will not be as hungry as they thought they were going to be. And after 7 days, they're not going to be hungry at all. They're not even going to miss it. And they'll actually sleep better at night. They won't have the reflux and those sorts of things as well. And so a 2-meal-a-day program can actually go a long ways in improving BDNF and also have an antidepressant effect. But the meal you don't want to skip is breakfast. Breakfast is actually the healthiest meal in the day for mental health, better cognitive performance, better scholastic scores, improved learning and memory, improved creativity. In other words, frontal lobe goes up, and there's a link between skipping breakfast and depression that has been shown. And breakfast eaters have a more positive mood, perform better on spatial orientation tests, and feel calmer at the end of testing as well. So a number of advantages for that. And that's one of the reasons why my wife wrote the cookbook, Brighten Up Breakfast, to have good breakfast food that has enough of these nutrients in it and things like that. We actually utilize it as a cookbook in our program, and can make a huge difference in mental health by not skipping that aspect of things. So I will open it up for questions here in a little bit, but I'd just like to summarize what the Lancet Psychiatry, this is a prestigious medical journal in Europe, after it reviewed some studies, some of which we've gone over today, but also others. Of course, this is not a complete study. We have several talks in our program on nutrition in the brain, and one just on the epigenetic part of things, so there's a lot more that we could present, but this is about as much as what you might be able to digest at one time. But notice what the study's author at the end of this section on nutrition in the brain state. Now is the time for the recognition of the importance of nutrition and nutrient supplementation in psychiatry. Nutritional medicine should now be considered as a what? Mainstream element of psychiatric practice. And if your psychiatrist isn't talking about nutrition or asking you about what you're eating or measuring those sorts of things, they're not mainstream. They're old school. And we really need to get to the root of the issues in biochemistry to make a difference. And nutrition can produce a far more powerful effect without the bad side effects of our normal way of treating psychiatric illnesses. So I hope this is encouraging you to learn more about this field and to also try to get at the root of this as well. I will close with the French philosopher Denis Diderot. In the 18th century, he said, "Doctors are always working to preserve our health and cooks to destroy it, but the latter are often the more successful." It doesn't have to be that way if we can retrain the cooks. If we can retrain the cooks to have healthy food that's also tasty, there's no reason to go back to the other way of eating. And so this is what a lot of people think. They think that if the food tastes good, that it's going to be unhealthy. But it doesn't have to be that way. And if we can prepare food that's tasty and healthy, why would we ever want to go back to another way of eating? So I'll open it up for some questions at this time and see if you have questions. It could be, all right, we have some roving microphones coming around so that your question can be heard by everybody.
Please use the microphone so that people online can hear your question.
Okay, here's a question up here in the front.
Can you hear me? You can't?
We might need another microphone for her. Or wait a minute, he's going to turn on the...
So you mentioned supplementation?
Yes.
Okay. I had heard recently that the nutrients that we're getting from vegetables and fruits and things today is not what it was 20 years ago. So should we use supplementation like vitamin supplements and things like that along with our diet?
Okay, yeah, great question. What about the depletion of the soil? Here's what a lot of people don't talk to you about that are talking a lot about soil depletion. If we don't have enough magnesium in the soil, if we don't have enough iron or whatever the nutrients are, we actually will not be able to grow the fruits and vegetables successfully. So there has to be a nutrient-rich environment for even these fruits and vegetables to grow. Now, there are some things where it can be. For instance, selenium. There's more selenium in whole wheat up in the Dakotas because the selenium is more richer up there than it is down here in Texas for the Texas wheat farmers. But you still have to have some selenium. If there's no selenium there, the wheat isn't going to grow. And so there can be some partial truths to that, but it's not completely true. You hear from some people, and they will act like that we're just eating food that's totally unnutritious today and doesn't have these vitamins and minerals in it. No, they still have to have the vitamins and minerals. Oranges have to have vitamin C in order to grow. You can't grow oranges that are totally vitamin C deficient. And so that's one thing to keep in mind. But there may be some people, particularly due to genetic issues. You know, this is one of the things that John Sanford, he came out with a book. By the way, a little bit about John Sanford. John Sanford is one of the top geneticists in the country, and he knew genetics so well that he sold two of his companies for almost $1 billion. After he made all that money and sold it, he thought, all I know about is genetics, so what am I going to do with all this money? So he started to study what he wanted to study. And he was a devout evolutionist that had been taught the evolutionary method, but he was looking at mutations and what happens to successive generations. And he found out there's no upward mutations. In other words, your offspring have 150 to 300 new mutations that you don't have yourself. That's why it's called genetic entropy. And then he knew where all the mutations were at, and he started to extrapolate to see how many generations you'd have to go back till there were no genetic mutations. And he realized it wasn't that many generations, like 200 to 400 generations, and you'd have pure genetics. And that's when he opened the Bible and started to look at genealogies, and he recognized, you know what, this Bible is onto something. And there's genetic entropy, there's deterioration of the genetic code. Now, the reason why I mention genetic entropy is because back in the antediluvian days, their genes were so pure that it didn't matter so much what their lifestyle was. They could actually get by with it due to healthier genetic immune systems and those sorts of things. But our genetic code is deteriorated enough that nutrition and lifestyle is more important than it's ever been. And the studies show, if, for instance, if you're an undermethylator, you're probably going to need to take something like SAMe and saffron for the rest of your life in order to be able to produce enough serotonin in the daytime and melatonin at night. If you have a condition that doesn't allow you to produce a long-chain omega-3, you might actually have to take an omega-3 supplement the rest of your life. But it's not for everybody. I don't necessarily have a one-size-fits-all vitamin and supplement for everybody, but it really depends on what their challenges are and what their issues are. For a plant-based vegetarian, I probably would recommend, if you're not measuring your B12 level, to take a B12 supplement, because B12 is not in plants and it's not in animals. It's not produced by animals, it's produced by bacteria, healthy bacteria, and we absorb that B12 from the last part of our small bowel because our bacteria in our colon were to make it. But we have a lot of problems with gut flora these days. And so 1 out of 3 plant-based vegetarians will run into B12 deficiency after a year. We store it for about a year, but we'll run into problems. And so, you know, I can measure my B12. I'm a doctor, and I can measure that. But if I couldn't measure it, I would be taking a B12 supplement every day, and my B12 is fine, like 2/3 of plant-based vegetarians are. But that's something that would just be safe, and it's not going to cause you any harm, particularly if it's the hydroxycobalamin. So there might be certain conditions or certain people groups that I might recommend that they take that just for general health. But once again, I don't have a one-size-fits-all for everybody. Yes, question. Back there, yes.
I have just to add on that. So what about the organic fruit and vegetables versus the regular ones that you can buy, and those ones that they have no taste? Like sometimes here, depends on where you live in the US, they have taste or not, and then if you live more north, they don't. Do they have the nutrients and everything still?
Okay. So yeah, even a tomato that doesn't taste as well is still going to have lycopene. It's still going to have a number of nutrients. It won't have as much, however. So organically grown fruits and vegetables actually have more antioxidants. The antioxidants are there for the plant to fight its own diseases. And so when we grow it organically, it can develop to actually be able to fight more diseases, and thus when we eat those fruits and vegetables, we're getting those antioxidants that are in richer supply. How much more? It's up to 74% more. So it's, or as little as 19% more. So that's the range of which you'll get higher bioflavonoids and nutrients by going organic. Now, having said that, a lot of people are afraid of eating anything that's not organic. And studies have shown that people that avoid fruits and vegetables due to the fact that they think they're going to get pesticides, actually 99% of them have pesticides in their blood to a high degree because the animal foods that they're eating that they don't recognize have pesticides in them. Pesticides are concentrated into the fat of animals 100 to 1,000 times more than what the fruits and vegetables have. And so it's still better to eat non-organic fruits and vegetables than to shift over to an animal-based diet to try to avoid the pesticides in fruits and vegetables. And the media makes that very confusing sometimes, and so people don't necessarily realize where they're going with it. But if you can do organic or grow organic, that is superior if we can get it that way. By the way, in regards to wheat sensitivity, a lot of people think they're sensitive to gluten. Over half of people that think they're sensitive to gluten are actually sensitive to the pesticides that go with the wheat. And if they get organic wheat, they're fine. And so that's something to also keep in mind. Yeah.
For those individuals who have inflammatory diseases that are going on in their body, for example, RA, that they cannot eat anything with lectin. I know beans and legumes are loaded with lectins, and the eggplant also is lectin rich. So what is your advice for those individuals who have those medical conditions?
Yeah, well, good question. First of all, not everyone with inflammatory diseases are going to be sensitive to those foods. It's only about 15% of those with inflammatory diseases that are sensitive to particularly the nightshades, like you mentioned, eggplant and even potatoes and tomatoes and peppers they can be sensitive to as well. But in regards to anti-inflammatory diets, the anti-inflammatory diets are going to be primarily your omega-3 foods. And by the way, we measure inflammation, inflammatory markers in every one of our patients because depression and anxiety is often an inflammatory disease of the brain. And so we're trying to actually decrease that arachidonic acid pathway. So number one is, even more important than the leptins or the lectins, is to get rid of arachidonic acid. Arachidonic acid is going to pour fuel on the fire of inflammation. And arachidonic acid is present in meat, fish, and eggs. A lot of the anti-inflammatories you get, they're trying to block the arachidonic acid pathway, and they all have side effects. But we don't have to worry about blocking the arachidonic acid pathway if we're not getting arachidonic acid in our diet. By the way, does anyone know where the number one source of arachidonic acid comes from an American diet? It's chicken. Yeah. Chicken is number one in arachidonic acid. Eggs are number two in arachidonic acid. Again, it's the egg yolk. So we want to get arachidonic acid out of the diet, and we want to get omega-3 up. Omega-3 is going to be in things like flaxseed, chia seed, spinach, things along that nature. And then we might also give supplements. One of the key supplements that's very important for inflammatory disorders, in fact, it's been used in controlled trials, is actually the supplement that was given to Jesus at his birth. Anyone know what that is? It's called Indian frankincense from India, which is also known as Boswellia. And Boswellia has been shown to treat Crohn's disease, rheumatoid arthritis, inflammatory diseases, and we have some great stories on Boswellia on how it's really cleared up a lot of different inflammatory conditions. And so that's a supplement that we might actually utilize for that.
I am a living testament for Boswellia.
Okay, all right, and another living testimony for Boswellia. Yes. Who's next? Yes, go ahead.
Yeah, thank you for the presentation. I've learned a lot. And there is one thing that maybe I've been waiting for you to talk about, which is the major ingredient in the kitchen, oil. Can you maybe say something about it? Because it makes food taste better.
Okay, what about oil? So there are, we've talked about some things that have quite a bit of oil in them. For instance, I think we talked about almonds. Almonds have a natural oil. That natural oil is higher in polyunsaturated and lower in saturated fat, which makes it actually lower our cholesterol levels. Almonds, even though they have oil, will lower our cholesterol levels. So will walnuts, so will soy, so will pecans. But there are some oils that will raise our cholesterol levels considerably. We have vegans in every one of our programs that come in with super high cholesterol, and they're pouring coconut oil on everything. Coconut oil is very saturated. It increases your liver's production of cholesterol even higher than what it might be by eating cholesterol. And so we don't have a shortage of saturated fat in our diet. So we don't need coconut oil. Even peanut oil can raise cholesterol in those that have an issue there. And so we look at good fats and bad fats. Now, in regards to if people are overweight, if people are needing to lose weight, if they have some other conditions, we actually may recommend that they're on a no free oil diet. There can be issues with excess free oil, but we don't necessarily make a hard and fast rule. We do want them to avoid the bad fats and utilize the good fats in moderation, because if we don't use them in moderation, we're going to start adding to the obesity epidemic from getting too much. But yeah, thank you for that.
Can you talk more about B17? We've been doing a lot of research, and apricot seed is rich in B17, but you have to be careful also because of the cyanide on it. So can you please talk more about it?
Yes, so vitamin B17 still has some controversy associated with it. It's actually not a B vitamin in its purest sense. In other words, it's not something that we need essentially like other vitamins for metabolism, but it is called B17. And it can have some anti-cancer properties. It can have some other beneficial properties, but as you mentioned, it tends to be in things that have more cyanide. If we are needing things that naturally have more cyanide, we would be recommending they take hydroxycobalamin. If you go into your emergency room with cyanide poisoning, they're going to give you IV hydroxycobalamin, which is a B12 to bind onto the cyanide and protect you from it. And so if we're needing to get some of the effects of B17, we're going to give it with hydroxycobalamin in order to avoid the cyanide. Anyone else? Yes, question over here.
Okay, can you hear me?
There
Okay.
we go, yes.
So I have a question about B12. You've said something about it before, but I have attempt to do research about it. Are there any good research out there that talks about what can increase someone's likelihood of getting B12 if you're not a meat eater, I guess, a meat-based, or if you're plant-based? Because you just said that you can't really get it from plants, and what else did you say?
Well, it's not produced by animals either.
Okay, so what can increase your likelihood? Because I saw an article that said maybe organic stuff because of the bacteria, and there's nothing that, since they're not spraying it with things. So what are your thoughts on that, and what other sources that you think I can look at to learn more about it?
Okay, so vitamin B12 actually has been found in very small amounts in spinach and some other green vegetables that are particularly grown in a high manure environment. Manure is going to have a lot of bacteria in that. And some of that can actually, by diffusion, get into the plant. So there can be some, it's not reliable per se that all spinach is going to have B12. It has to do with actually the environment that it's grown in. Now, having said that, 99% of the B12 patients, B12 deficiency patients in the US are not vegetarian. A lot of times people are ignoring that fact. Most B12 deficient people are meat eaters, and they are eating things that are supposed to have B12 in them. First of all, meat and dairy have less B12 than they used to have, in part due to the cleanliness aspect of things. You know, if we don't wash our fruits and vegetables, there's going to be B12 even in the dirt that we eat. And if you actually don't brush your teeth for a while, the bacteria in your mouth will start making more B12. But we recommend people wash their fruits and vegetables. We recommend that they brush their teeth and that they also get adequate amounts of B12. As far as one place to find that, I haven't been able to find one place to really put that all together, but our latest edition of Proof Positive in Chapter 20, I cite all of those studies, even in regards to the manure part of B12 and where else we can get our B12 from. And I would suggest, by the way, why are 99% of them meat eaters? As well, because they're not making intrinsic factor. We need to make intrinsic factor to absorb B12, and we might have a genetic issue where we're not able to make intrinsic factor in the stomach, which has to bind onto the B12 for us to absorb it in the terminal ileum. And so a lot of times people are concerned with vegetarians having B12 deficiency. By the way, Australia just produced a study not long ago among Seventh-day Adventist pastors, lacto-ovo versus meat eaters pastors versus total vegetarian pastors, vegan pastors in the Adventist church over there. Their B12 level between the lacto-ovo and the vegans were identical. In other words, lacto-ovo is not enough necessarily to have enough B12. So they had the same rates of deficiency of both. And so that's why I recommend, if you're on a plant-based diet, make sure you're getting B12 within a year. You don't have to make sure right away because you're going to have some storage. By the way, why does animal food have more B12 in it? It's not because it makes it, but because it's more contaminated with bacteria. So you have a lot more bacteria there that's there. But I would recommend that just on the safety side, it's very inexpensive, and get a good B12 supplement, or just measure it and make sure your B12 is over 500. We recommend it over 500 for optimal mental health. All right, I think you've been a very attentive audience. Is there anyone else with a burning question before we wrap things up? Yes.
I have one last question. I guess, short of coming to visit you in California, what can we tell our own doctors, or maybe even find, what is the doctors that are more natural, osteopaths or something like that? How can we know if we're deficient in something and we're okay here? And, is it exclusively blood tests and running the right kind of tests?
Well, that's the way to know for sure, is the blood test. You might get an idea in regards to symptoms and things like that as well. But as far as physicians, unfortunately, the typical physician only gets one nutrition class, and it might not have even been in medical school. And here's one of the biggest fallacies. In fact, it's kind of my pet peeve. Today, it's more polarized than ever before. But we have these doctors. Let's just take COVID, for instance. We'll have these doctors that'll say, I'm not giving this patient zinc. I'm not giving this patient melatonin. That's all natural stuff. It doesn't work. And I'm only going to give them remdesivir, or I'm going to give them some drug that has been shown. And they act like they're the purist that have all the data behind them. They actually don't have all the data behind them. And it might be true that those drugs have gone through a more rigorous trial, Why does it have to go through a rigorous trial? Because these are foreign substances that can cause a lot of harm. That's why we have to put millions of dollars into those studies. When melatonin, actually in a randomized controlled trial, melatonin was shown to be beneficial for COVID. It's a natural agent. And there's something else even more beneficial. It's called quercetin. Quercetin, if you take it with an oil, safflower oil, increases the absorption of quercetin by tenfold. It decreased the hospitalization rate of entry from an average of 7 days to an average of 1 day. Dramatic difference in quercetin. But because the FDA doesn't talk about it and whatever, these doctors are just ignoring mountains of research. And really, the balance is in the middle there. It's not that all of these drugs should never be used because they're foreign. Some of them can actually have some positive effect. And, even as a doctor that talked about antidepressants, I should admit that in some outpatients, I actually prescribe them short-term while I'm working on the long-term things that are going to help them out. But we're also going to be utilizing natural agents that are going to really help that situation out. And unfortunately, it's very hard today in this polarized society to find physicians who are balanced. Many of them have been politically influenced and way too polarized to be balanced in this area. And so you'll just have to go by word of mouth. Who is it that has the best evidence in regards to looking at not just pharmaceutical approaches, but actually natural approaches that can sometimes be superior to it. But yeah, great last question. And why don't we pray before we close. Father in heaven, we thank you that you are interested in the health of our body, mind, and soul, and that you made foods that are healthy for us and tasty. We utilize them in accordance with your will. We pray your blessing upon each attendee here, that you would circle them with your arms of love, and that they might be open to not only receiving this information, but applying it in their life, where they can be a positive influence to others around them. And we thank you for hearing and answering this prayer in Jesus' name. Amen. Well, it's been nice being with you in Austin. Erica brought a few things on the plane that you may want to look at on your way out, just to see what is available that you could take in hard form. And also turn it over. Are you going to say anything before we close?
Well, on behalf of Austin South, I'd like to thank Dr. Nedley for visiting today. I'm sure we are all blessed with the information, and this is recorded, so it was live streamed. You can go to our website to, I'm sure there was a lot of information you'd like to go, what did he say at minute 5? So we'll be able to look at that. So again, thank you, sir.
Thank you.
Thank you so much.
Oh, you're very welcome.